Welcome to Health with Samantha DPT. I'm Samantha Holland, Doctor of Physical Therapy, and this video is about low back pain due to a disc injury. So disc injuries can happen most commonly in the low back, but anywhere in your spine. And they're due to multiple reasons, but I want to kind of clarify what they are and signs of them and what you can do to help yourself. So a disc can be bulging, herniated, sequestered. There's different levels of what it means to have a disc injury. So what happens is you have the discs that sit in between the bones of your spine. So you've got the vertebrae and a disc that sits in between. And the disc has outer layers surrounding a nucleus. So when those layers get torn, the disc is injured and that nucleus in the center can be pushed out. And that's when you start to have pain, especially when that bulge or the extruded material starts to affect the nerve roots that are nearby, just lateral to the discs. So most commonly, a disc ruptures, bulges, is herniated to the back and to the lateral side, to one side. So that's where it starts to impinge on the relative nerve roots associated. A disc injury, you may have heard and experienced yourself, commonly happens when the disc is loaded and rotated on. So the most common way to get a low back disc injury is if you lift something heavy and then twist, because those cross fibers surrounding the nucleus and the disc are at their weakest in the rotational movement. Okay, so you just want to be very careful if you're holding something heavy not to do excessive twisting with that, because you're just loading and grinding on that disc. One of the best ways to counteract the pressure on the disc yourself is to be working on your core strength, posture, ergonomics, those kinds of things. But just know, if you're in physical labor where you're having to lift and carry heavy things, that's, setting you up potentially for a disc injury if you're not doing things properly. So of course, knowing good squat mechanics, good core engagement, that kind of stuff really is very helpful to protect your discs. So when it comes to an acute disc injury, like you heard a pop or you know that you injured that disc, because of the posterior lateral or that extrusion back into the side, most commonly, the best position to go in immediately is on your stomach. Now, I won't get into the anatomy of why that is, or the physiology, if you will, but just know most commonly, if you have an acute injury to a disc, you need to get on your stomach and try to stay there to help reduce your symptoms. Secondly, I would suggest icing the area, maybe 15 minutes at a time, multiple times a day, to reduce some of that inflammation and kind of calm down the area. Then, I would definitely seek help from your doctor, physical therapist, get proper treatment, because yes, a disc can heal if taken care of properly and it's not too far gone, if you will, but usually an acute disc injury, you can manage it with conservative treatment. And like I said, the discs usually happen in that acute manner. They can happen in different ways. It's usually a traumatic incident in a younger population, more of an abrupt tear, but you can have low-grade disc injuries that get worse over time. Now, if you have imaging done, say at a physical, and it shows that you have, some degenerative disc disease, a lot of people may have that on their imaging and not have symptoms. It's inevitable over time that those discs are going to degenerate to some degree, so don't be too alarmed if you get told that on MRI or X-ray. But the main thing is going by the symptoms and just working with general strength of your hips and core to help protect your low back. All right, so if you think you've had a disc injury, you'll usually experience pain, difficulty bending forward a lot of the times, and you probably shouldn't do that, just as a protection to the area. You'll have numbness and tingling potentially in the area of the nerve root affected. So if these things are happening, I would definitely suggest you get further looked by a clinician, and hopefully you can get that disc healed better on its own. If you have more questions about this, please feel free to comment, message me, and then like and subscribe to see more videos like this. Thank you so much for tuning in, and have a good one.